Hello and good day, everyone. You are attending an educational webinar of the International Pediatric Oncology Guidelines in Supportive Care Network, or the iPOG network. Thank you for being here. I'm Lee Dupuis, co-director of the iPOG network. Our speaker today is Dr. Adam Yan, an oncologist at the Hospital for Sick Children in Toronto, Canada, and an assistant professor in the Department of Pediatrics at the University of Toronto. He completed his pediatric residency and a subsequent fellowship in pediatric hematology oncology here at Sick Kids. But recognizing the potential of digital health, Adam then pursued a clinical informatics fellowship at Boston Children's Hospital and earned a Master of Biomedical Informatics from Harvard Medical School. Adam also chairs the Pediatric Oncology Committee at EPIC and serves as the Associate Chief Medical Information Officer at Sick Kids. In this leadership role, he integrates clinical expertise and informatics to enhance patient care. He also chairs the Pediatric Oncology, he has led the integration of the symptom screening tool SSPedi into the electronic health record platform here at Sick Kids, EPIC. And today, Adam will share information about SSPedi implementation at Sick Kids with us. A reminder to the audience, please enter your questions using the Q&A tab on your screen throughout the presentation, and we'll raise your questions with Adam at the end of the presentation. So please welcome Dr. Adam Yan.
Thank you so much for the warm welcome, Lee, and for bringing us all together today. I'm very excited to share with everybody our journey in implementing SSPedi for standard of care symptom management here at Sick Kids and to share the work we're doing with EPIC more broadly. Today, we have three objectives. The first is we'll start by giving everyone some foundational knowledge about SSPedi, and we'll review the initial development and validation of SSPedi. Second, we'll talk about the steps we took in creating an electronic health record, or EHR, embedded version of SSPedi. And then finally, we'll conclude by discussing our actual experiences in implementing our EHR embedded SSPedi for routine symptom management. So let's start by talking about SSPedi so that we all start from the same place. We know that in pediatric cancer, symptom control is quite poor. This is a graph showing newly diagnosed patients' symptom burden. Almost all patients experienced bothersome symptoms, and severely bothersome symptoms were experienced by a number of patients as well. This offers us the opportunity to intervene earlier to help manage these symptoms better. In order to address this issue, Lee, along with Lillian Sung and many other collaborators, created SSPedi. SSPedi is a patient-reported outcome tool that allows patients and their family members to report bothersome symptoms of patients. The original version of SSPedi has 15 questions, and questions are entered by either the patient or the family member, depending on the age of the patient, and questions are scored from not at all bothersome to extremely bothered. You can see that depending on the age, there's the traditional proxy SSPedi, which can be completed by the parents. There's SSPedi, which can be completed by patients, mini SSPedi, which can be completed by younger patients, and then co-SSPedi, which is a dyadic report where the patient and the guardian complete the questionnaire together. Recognizing the need for symptom reporting not just in English-speaking countries, SSPedi has been translated into numerous other languages as well. Symptom screening on its own is not enough. Clinicians need to have an action plan for what they do next when a patient or a family member reports a bothersome symptom. Fortunately, here in Ontario, POGO, which is the Pediatric Oncology Group of Ontario, has a long history of creating clinical practice guidelines, or CPGs, to address various supportive care topics. CPGs collate the best available evidence on a given topic to help guide clinicians in making evidence-based decisions for their patients. The drawback of CPGs is is that these are often highly textual scientific documents that can't be used at the point of care with a patient. In order to make CPGs more accessible to the everyday clinician, we've worked to create care pathways. Care pathways take those evidence-based CPGs and translate them into a highly visual document that can guide clinicians with a patient in front of them in making the best next decision for their patient. The care pathways that we've developed are freely and widely available both on the POGO website and on the Sung Research website. POGO has also recently taken an initiative to develop a software that allows sites to take the base care pathways that have been developed and tailor those care pathways to the unique situations of their hospitals, recognizing differences in local practices and resource availability. So what we know is that systematic symptom screening using a patient-reported outcome tool like SPEDI needs to be paired with actions to address those symptoms, such as care pathways that we've created with POGO. Recognizing these two key pieces, two recent randomized clinical trials have been conducted of SPEDI, one in Canada and one in the United States. The clinical trial done in Canada randomized individual patients to receive symptom screening with SPEDI compared to usual care, where the trial in the United States randomized whole hospitals to either use symptom screening or usual care. First, we're going to review the cluster RCT from the United States. In this RCT, 20 American hospitals were randomized to either usual care or symptom screening with SPEDI. At the intervention sites, the hospitals adapted those care pathways that we looked at to suit their individual contexts, and then patients received SPEDI via email or text reminders. Symptom screening was completed 3 times per week for 8 weeks. If a patient reported a severely bothersome symptom, an email was sent to their healthcare practitioner notifying them of this symptom. Control sites received usual care. The main outcome of this study was the total SPEDI score on a range of 0 to 60 at 8 weeks post-initiation of SPEDI. Higher scores show more bothersome symptoms. In this study, there was a statistically significant difference in the total symptom score for patients at usual sites compared to intervention sites, with a decrease in that symptom burden at intervention sites. This showed that systematic screening using SPEDI coupled with care pathways decreased symptom burden. When we looked at each of the 15 symptoms that SPEDI addresses, 12 out of the 15 symptoms had a statistically significant decrease in the symptoms when using SPEDIs coupled with care pathways. Similar findings were identified in the second RCT, that was the individual level patient RCT done in Canada. In this study, 8 Canadian sites randomized individual patients to complete SPEDI or not. Patients reported SPEDI daily for 5 days, and emails were sent if bothersome symptoms were reported to their healthcare practitioners. Controls had usual care. Similarly, in this study, there was a decrease in total symptom burden, and 8 out of 15 of the symptoms showed a statistically significant decrease at the end of the study. Coupled together, these two studies really show that systematic symptom screening coupled with interventions can decrease symptom burden for pediatric patients with cancer. Building on this work, it was now our goal to take these studies and translate them into real patient care for the average child receiving cancer therapy. To accomplish that, we hypothesized that we needed to embed the SPEDI tool into our electronic health record. So now I want to talk about the steps we took in embedding SPEDI into our EHR. So first, let's talk about the value of EHR integration. You might wonder why, after creating Spark, which is the tool we use to administer SPEDI in the research studies, do we need to create a new platform for administering SPEDI? We know that patients are exposed to numerous digital health tools. We know that the patient experience and their willingness to use a new tool decreases based on the number of tools they're exposed to. We hypothesized that EHR integration of SPEDI would improve logistics for family by decreasing the number of logins and apps they need to keep track of and download. It also would improve the usability of the tool because it's a familiar user interface that the patient might be using to complete other tools in other clinics or other functionalities of the platform. On the clinician end, we know that reviewing data from the patient-reported outcomes is key to the success in decreasing symptom burden. We felt that by allowing the inline review of patient-reported outcomes within the electronic health record would maximize clinician efficiency. It would also allow clinicians to contextualize that data within the realm of other chart data, such as their current medications or their labs, to help them interpret those SPEDI scores. And it also allows clinicians to directly address SPEDI symptoms by ordering medications or making adjustments to treatment plans based on that data. Finally, on a more global level, we know that in an individual institution level, there are a lot of hurdles to implementing a new digital health tool, such as privacy and security concerns. So leveraging an existing platform, such as the EHR, can mitigate some of these logistical challenges. So how did we approach building SPEDI into the EHR? So at SickKids, we use an EHR from Epic, which is a common EHR vendor used across the world. And I was lucky at that time to be the chair of the Epic Pediatric Oncology Steering Board. And at the Oncology Steering Board, there are representatives from numerous sites across the world who are pediatric oncologists. And the development of an Epic integrated PRO tool was identified as the board's priority topic. At the same time, here at SickKids, we were working to evaluate an approach to use SPEDI for routine care. So because Epic, the organization, and locally, we were both trying to accomplish the same task, we were able to work with the Epic Wisconsin, which is the main campus of Epic's development team, to create a tool in Epic Foundation. Epic Foundation is the version of Epic that is provided by the EHR vendor to every site that subscribes to Epic. So working with the main development team at Epic, we developed a foundation SPEDI tool that could be rolled out to any hospital that subscribes to Epic. We first took that tool at SickKids before its more global release to identify any optimizations or issues with that care plan. We provided that feedback back to the main campus of Epic so they could roll out a more optimal care plan to other sites. In terms of our journey, we just recently launched our local care plan in April of this year. And Epic, the organization, will launch it into the foundation system in the fall of 2025. One of the very exciting pieces of the Epic SPEDI Care Plan is that the data will be available in Cosmos. Cosmos is a data warehouse that links data from various Epic sites. So potentially in the future, the site would be able to landmark their SPEDI data against the Epic averages of data to identify opportunities to improve local control of a given symptom. Partnering with Epic, we're also hoping to translate SPEDI into additional languages for administration through Epic as well. However, at Go Live, the SPEDI version in Epic is only available in English. So what does the SPEDI care plan in Epic look like? So the care plan actually has a variety of functionalities. There are some core functionalities for clinicians, core functionalities for patients, and then some global reporting tools that are highly valuable as well. On the clinician end, we can perform routine symptom review an escalation symptom, which are the bothersome symptoms that patients report. We have the care pathways that help guide management, and then tools to assist in documenting SPEDI scores. On the patient end, we have educational material to help prevent symptoms, a tool for reporting symptoms, and then self-management education material for patients who report bothersome symptoms. On the reporting end, there is a report to track which patients are eligible for SPEDI. There's a report where we can see all of the patients globally in our clinic and see their scores to track how we're doing on a population level. And then we also have a dashboard to monitor global adherence to the program. And we'll go through each of these tools in more detail now. So how does SPEDI work on a global level? So patients at our hospital can enroll in a patient portal called MyChart. MyChart is Epic's patient portal that they've released, and MyChart has various functionalities such as medication monitoring, such as clinic scheduling, and it also allows patients to enroll in care plans such as SPEDI. So for a patient who's enrolled in the SPEDI care plan, they receive a reminder through MyChart 3 times a week to complete the SPEDI questionnaire. They also can complete the questionnaire ad hoc as they want as well. If the patient reports severely bothersome symptoms, 2 things happen. First, the patient in real time is provided with a self-management tip sheet. And at the same time, an in-basket or message alert is sent to that patient's primary doctor and their nursing team to inform them of this patient's symptom. If no bothersome symptoms are reported, that data is passively filed into Epic and can be routinely reviewed by their nurse and physician when they see the patient next. For all symptoms that are reported, we have care pathways that guide intervention to help manage those symptoms. So now I want to go through the patient-facing tools in more detail. The screenshot here shows the welcome page in Epic's MyChart to the SPEDI care plan. As you can see, the patient is assigned various tasks, and as they complete those tasks, this completion bar, which is currently at 0%, gets filled for the day. For this patient, they've newly enrolled in the care plan, and you can see 2 tasks. One is a welcome task, which explains how to use the care plan. Then the second is the SPEDI symptom screening tool, which is where the patient would report how they're feeling today. So our first goal is to prevent symptoms. So what we have done in SPEDI is that once a week for the first 4 weeks of enrollment in this care plan, we provide an educational task to the patients. So on the Monday of each of the first 4 weeks of enrollment, the patient is sent a message in MyChart with an education task to complete. And the education tasks focus on emotions and coping, sleep, nutrition, and physical activity, areas that we believe can help prevent various symptoms that are reported through SPEDI. And this allows patients to review this material to try and prevent the development of symptoms. What happens next is that 3 times a week, a patient receives a reminder to complete SPEDI. The first screenshot here is of a push notification on the phone, and the second is of a text message reminder. Patients have the ability to choose if they want to receive text reminders, push notifications on their phone, both, or no reminders at all. Once a patient receives this reminder, they can click on the link and it takes them to the SPEDI questionnaire. The SPEDI questionnaire lets you select who's completing it, either the patient or the guardian, and then you can fill out all of the 15 questions here and submit those scores to your clinician. If a patient submits a score that indicates they have a bothersome symptom, the patient in real time is then provided with a new education task that allows them to review tips on how to manage their bothersome symptoms. So they get this task here, and if they click go, it takes them to this dashboard. For each of the 15 symptoms, we've completed a tip sheet for the patients. So at the top here in the first box, it shows the tip sheets for the bothersome symptoms that that patient reported today. Then here at the bottom, it also shows the library of all the possible tip sheets in case a patient was interested in reviewing a tip sheet for a symptom that they hadn't reported today. And this is an example of one of those tip sheets might look like. The tip sheets are all structured similarly in three categories. The first category is things the patient can do to self-manage, so things they can do with their family. The second category is things they can do with their care team. This empowers patients to discuss potential interventions that their care team might offer to them. And then the final category is when should they call for help? One of the concerns that often healthcare providers raise in patient-reported outcome interventions is what happens if my patient has a symptom that's not appropriate for a routine review when I come to clinic tomorrow. And the goal of this is really to guide patients to identify when potentially a symptom is so severe that they need to, pick up the phone and call for immediate help. And all of the care pathway self-management tools we've created are all freely available on About Kids Health, which is an education site hosted by Sick Kids. Now we're going to switch and go through what the clinician-facing tools look like as part of SPEDI. So the first goal in SPEDI is getting people enrolled, and enrolling patients in SPEDI can be done through the treatment plan. We know that the majority of pediatric cancer patients receive systemic chemotherapy, and that chemotherapy is ordered as part of structured orders in a treatment plan in EPIC. So what we did was put a default order into all of the eligible treatment plans. And at the time of signing chemotherapy for a patient, you can sign the SPEDI order, and this automatically enrolls a patient into SPEDI. For sites that would be interested in adopting SPEDI, alternative ways could be done where patients could be automatically onboarded into SPEDI as well. So once a patient is onboarded into SPEDI and that patient has submitted their SPEDI scores, the most important thing on the clinician end is reviewing those scores. So we really wanted to make the SPEDI data accessible and easy to access for clinicians. So the front landing page, when you open a patient's chart in Epic, is this kind of chart review screen here. And we added this tab called SPEDI Scores. So as soon as you open a patient's chart, it immediately shows the SPEDI scores on the landing page that you open. And it actually will show a trend of the most recent SPEDI scores that that patient has submitted, along with the information on who submitted those scores, the parent or the guardian. In addition, we know that often oncologists have many patients in their clinic, and they might not be able to review everyone's SPEDI scores all off the bat. So we created a emoticon in the patient column list. So when you open Epic as a clinician, you might have a list of all your patients that you're seeing in clinic today. And in this clinic list, it might show you important key information. So we created this column called SPEDI. And the SPEDI column has a emoticon that really quickly tells you about the patient's SPEDI data. So if you see two red exclamations, it means that that patient submitted data and there is a bothersome score for review. This might prompt you to open the chart and click on that data and review those SPEDI scores. The second is the green check mark. This means that the patient submitted scores and they're all good. So this might be a patient where you say, I'm not going to look at their SPEDI scores right now because there's nothing bothersome. And then the third is a blue question mark, and this means that the patient hasn't submitted any SPEDI scores in the last 48 hours. So this might be a patient where in rooming the patient, a nurse or a unit assistant might remind that patient to say, we noticed that you haven't submitted any scores before your doctor or nurse practitioner sees you today. Do you want to fill out some scores? And that could be done using the patient's own phone or be done using a device such as an iPad provided in clinic as well. We also have a mechanism for symptom escalations using SPEDI. So when a patient reports a bothersome symptom, we don't want clinicians just to passively have to open a chart. So we actively send the primary nurse and primary physician a message in Epic saying this patient has bothersome symptoms, and then it shows which symptom is bothersome as well. We also created a tool that allows clinicians to pull those symptom scores into their clinic note for the day to allow them to document more readily about those patients' symptoms and the interventions they may have taken to address those symptoms. Finally, we have the care pathways, which we looked at previously, and these help guide clinicians in taking evidence-based strategies to address and manage the symptoms reported by their patients. The final set of tools that we have are the three reporting tools. So this is an example of a screenshot of an overarching report that shows all of the symptoms reported for a whole clinic. So I might, as a clinician, say, I don't have clinic today and it's Wednesday, but I want to see if any of my patients have reported any bothersome scores. Or a nurse in clinic might say, I want to know all of the scores for everyone in clinic because I have some time to phone some patients. So you could open this report and it shows you all of the patients in your clinic enrolled in SPEDI, shows you when they most recently completed SPEDI, and then it shows you if they have any bothersome symptoms. So it shows a green, yellow, or red circle for each symptom, depending on what scores were reported. We also want to track adherence or use of SPEDI. So we also have created a dashboard that is available to all of the SPEDI sites that tracks what proportion of patients are using SPEDI and completing each of the tasks. Finally, I just want to comment on the timeline for this. So we started planning the SPEDI go live in November of 2024. And when I say planning, this means that we had commitment for the resources to start SPEDI. And then we went live in April of 2025. I think for other centers interested in using an Epic embedded SPEDI, this timeline might be shorter because you wouldn't be starting from scratch. You would potentially have the Epic Foundation version as a launch pad to go from. In the last few minutes, I want to talk about our experiences in using the EHR embedded version of SPEDI for routine symptom management so far. So the first thing we did after the design and development of SPEDI is we completed usability testing. We wanted to understand in the real world how patients who had never been exposed to symptom screening before were able to use SPEDI. So we had patients and their caregivers complete SPEDI using either a mobile phone or a computer, and then they switched over and used the alternative tool as well. And we found that 75% of users preferred completing SPEDI on their phone compared to using it on the computer. We then assessed if patients and caregivers found completing SPEDI easy and if they completed SPEDI correctly. And using the mobile phone, 95% of patients found that it was easy to use, and using the computer, 80%. And then when we looked at correct completion, 85% completed it correctly using the phone, and 90% using the computer. So based on this usability testing, we felt that it was appropriate to continue with our EHR embedded version of SPEDI and to start distributing it more widely. So what is the feedback that we've received so far? So we know that there are some barriers in completing SPEDI. One barrier is access to devices. Most patients have access to a device, but often that device might be their parent or guardian's cell phone, and this can often impede ability of a patient to self-report symptoms. And for teenage patients, they might not want to have their parents necessarily involved in that process. A second barrier that was surprising to us that we hadn't necessarily anticipated was the timing of those SPEDI reminders. The default setting is to send reminders at 9 in the morning. And we identified that many of our patients might be at school during that time, which might not be the opportune time for those reminders. Unfortunately, we can't change that reminder time as a default, but individual patients can change that time. So we've added that information into our onboarding routine now to change the time of reminders to a more optimal time for a given patient. In terms of healthcare team engagement, we've had good feedback about providers addressing the symptoms that are reported from Speedy. One of the potential limitations in advertising Speedy is that a lot of patients feel that the symptoms are addressed, but that the clinicians might not actively comment that they received this information from Speedy. We really need patients to feel like their patient or their caregivers are reviewing those Speedy scores to encourage them to continue submitting those Speedy scores. We're really working with our care teams to try and get them to use the language of I saw your Speedy scores or I saw on Speedy that you reported this to remind patients that we are reviewing that data and that that data is driving their care. So in summary, we know that using Speedy for routine symptom screening with symptom management care pathways can improve symptom control. We know that the EHR embedded version of Speedy is easy to use and is completed correctly by most patients. We're very excited that the Epic embedded version of Speedy will be widely available to the Epic community via Epic Foundations in fall of 2025, with accompanying ability to push data to Cosmos for sites that are interested. And we are exploring actively other ways to administer Speedy in terms of integration with other EHRs that are not Epic, as well as with the original Spark hosted version, which was used in the clinical trials, recognizing that all sites might not have an EHR or all sites EHRs might not be able to seamlessly integrate patient-reported outcomes. And I just wanted to thank the many, many people who have been involved in bringing Speedy to where it is today, really to Lee and Lillian Sung, who were the initial brains behind Speedy, who did really the foundational work to create, validate Speedy, conduct the RCTs, and who both have been incredible and instrumental mentors for me. And then along with the rest of the Sick Kids, Epic, and Pogo teams who have helped in bringing Speedy this far. Thank you guys for having me today, and I'm happy to answer any questions.
Thank you very much, Adam. That was a lovely presentation. We're seeing your calendar now, just in case you're concerned about that.
Not sure how to stop sharing screen.
Or I can stop share. Oh, there we go.
Perfect.
So yes, I thought that was a beautiful summary of Speedy and the work that was done at Sick Kids to embed it into our EHR. There are some questions in the Q&A, and I just encourage other people in the audience to put your questions or comments into the Q&A. So I will start a few questions about Speedy functionality. Have you found any symptoms not included in Speedy? And is there a chance for patients' relatives to report something not listed as in a text box?
Yeah, that is a terrific question. So we do have a text box at the end of Speedy for patients or their caregivers to report other symptoms that they're feeling as well.
I just add to that, in all the work that we've done with Speedy on paper, electronically, very few patients or proxies have entered any symptoms in that box, but it is there in case respondents want to convey some additional information. And the next question is, how often can Speedy be used by the patient? And how will clinicians know that it has been filled in?
Thanks for that question. So patients or their caregivers can complete Speedy as often as they want. They are prompted to complete it 3 times a week, meaning that they receive a reminder to do Speedy. But if between those reminders, they're feeling sick, or even on the same day that they did it once, if they have new symptoms, they can do it ad hoc as well. In terms of how the clinician will know that it's been filled in, that depends on if a bothersome symptom is reported or not. So if no bothersome symptoms are reported, that data is just filed passively into the EHR, so they're not actively notified. But when that clinician goes to see that patient or review their clinic list, they can review that data. If a bothersome symptom is reported, then an active notification via the inbox in Epic is sent to both their primary doctor along with their primary nursing team.
Thank you, Adam. Next, have you considered patients who are illiterate, have accessibility issues, or are blind? Are there any modifications to address these barriers?
So I think this is our first attempt at integrating Speedy into Epic, and we recognize that there will be patients that are unable to complete Speedy. I think the biggest barrier locally for us will definitely be language barriers, where we do have a substantial number of patients who cannot read or write in English. So I think our first priority will be to work at seeing how we can translate the Epic version of Speedy into other languages to increase accessibility. Um, we haven't explored at this time other potential accessibility modifications for patients who might be blind or illiterate. We do allow caregivers to enter scores. So as long as one member of either the patient or one of their caregivers is literate in English, they would be able to enter that data.
And just to remark, the version of Speedy on Spark allows patients to have the entire instrument read out loud to them. And that's one feature that we weren't able to bring into the Epic version. Next, have you found patient or caregiver fatigue at the number of requests that they receive for completing Speedy?
That's a great question. Thanks, Stephanie. In the original trials of Speedy, they did it for 8 weeks. This will be the first time that patients potentially complete Speedy for longer durations of time beyond 8 weeks, where caregiver fatigue would be definitely something to consider. One of the benefits of Speedy is that it's only 15 questions. So compared to other tools that have been developed that might have 40, 50 questions, Speedy can be completed in general in about 1 minute, which really hopes to minimize the burden on caregivers. EHR integration was a key step in trying to minimize caregiver fatigue. We know that having numerous different electronic health tools, numerous apps, numerous logins contributes to that. So this tries to streamline that reporting of symptoms with other digital approaches the patient might already be taking, such as digital check-in for their clinic visit. But I do agree it's something that we'll have to assess over time what the impact of this is on the reporters if they're doing it for months or even years.
Mhm. And from Elsa Briggsma, do you differentiate between the urgency of specific symptoms, even when they're rated as highly bothersome? For example,
Uh,
pain versus feeling fatigued.
So in the build in Epic, there's no difference. So any bothersome symptom immediately triggers an in-basket alert to their primary care team. That doesn't mean that their primary team is going to respond with the same urgency to all of those messages. So I can say, personally as a practicing clinician, exactly as you say, if I have a patient that reported that they're more tired and I know they're coming to clinic tomorrow, I might say this is something that I've registered and I'm going to address tomorrow when they come to clinic. Versus if I have a patient who reports that they're having significantly bothersome pain, it might be a patient that I decide to call, at the end of my day today. We purposely did not put in any requirements for clinicians in terms of a time frame to respond to symptoms that were reported, because we recognize that there's a lot of nuance in how you might interpret symptoms. So you might have a patient that you were well aware that they were already in pain and that you already had, made a change that morning to try and address their pain, and you might not feel the need to respond to that right now. So given that patient care is incredibly nuanced, we didn't feel it was appropriate to mandate any timelines for response, but leave that up to individual care providers.
Thank you, Adam. Courtney Sullivan is asking you to blue sky a little bit and envision the process that you've described today for outpatients being adapted to the inpatient setting.
Thanks for that terrific question. It's actually something that I sort of glossed over, not purposefully. So the Epic tool that we've used to build Speedy is something called a MyChart Care Companion, and it actually is exclusively available in the outpatient setting. And this was not something that actually was apparent to us when we started on this journey. It actually came out a couple months in when we asked a question about inpatient Speedy, and they said, oh, this tool is only an outpatient tool. Thankfully, there is a corollary in the inpatient setting called MyChart Bedside. At Sick Kids locally, we actually didn't have this module of Epic purchased when we went live with Epic, and we have since purchased this module. So we are just now embarking on our pathway to also do Speedy as an inpatient as well. So we're hoping within the next year that we'll be able to launch inpatient Speedy as well. I think on the inpatient side, the logistics are actually much simpler, because you have the ability to remind patients to complete those questionnaires in person. You can have signage in the rooms to remind people to complete those questionnaires. And then it's easier to build in a culture into rounds where, currently for us, we say, okay, here's the heart rate, here's the blood pressure, and now here are their bothersome Speedy scores. So I actually think that inpatient use of Speedy would be easier than the outpatient use. And I think if we had had access to both modules from the get-go, we probably would have done inpatient first and then expanded to outpatient. I also think the intensive relationship on inpatient will allow patients to get more comfortable using Speedy and hearing about Speedy, that will then translate into better adherence in the outpatient setting, because they've become, more used to using the tool and have their nurse that can, help them navigate the screen the first few times.
So there's a lot of interest in this topic and a lot of questions, but I'm going to pick one last one since we will close shortly. From Bob Phillips, has anyone that you know of tried it in a non-Epic system? And how has it worked when done in paper?
So to our knowledge, nobody has tried it in a non-Epic system. We are exploring very preliminary right now with some other organizations that use Cerner, how they might do this in Cerner. And we haven't looked at other EHRs other than Epic and Cerner right now, but it would be something we're interested in. In terms of how it's worked when done in paper, maybe I'll defer to Lee on that one.
I know of several places that have been using Speedy on paper, and it's to the best of my knowledge, it's a situation where patients do their Speedy on paper in the waiting room prior to a clinic visit, and that is very immediate. All right. So Adam, thank you so much for such a clear and informative presentation. It was excellent, and you can tell by the questions and answers that there's a lot of interest. I would ask you if you'd like to send me your questions that you would still like Adam to answer, and I'll twist Adam's arm and ask him to answer them. So thank you all very much for attending, and I hope you found this presentation as informative as I did. Thank you very much.